Lifting is so much a part of our everyday activity that many of us don't even think about it. We simply walk up to an object, take hold, and hope for the best. In fact, there are positive steps to follow towards safe lifting. The first step in any lifting operation is to assess the lift. Look at the load and the environment through which it must be moved. Clear the area of hazards. These could include such things as hoses, leaves, tools, and other obstructions on the floor. And ensure the surface is not slippery or greasy. Check the load for potential hazards, such as sharp edges and protruding staples. Make sure there are no leaks or spills, and wear appropriate shoes, as well as any additional protective clothing, such as gloves, if necessary. Gauge the weight of the load before you lift. This can be done by a combination of reading any information that may be printed on the item to be lifted that may indicate the contents and weight of the load, and by simply moving the load sideways or backwards and forwards. This is a very important step, as it allows the person to ascertain whether or not the load to be lifted is within their own lifting capacity. Do not attempt to lift if you are not convinced you can handle the load safely. Now that you have judged the path is clear and the object is safe to lift, you can prepare to lift it. Stand close to the load, preferably in the direction you wish to move. Use a wide stance to ensure you are stable and balanced. As a general rule, the front foot should be beside the object, and if possible, pointing in the direction of travel. The back foot should be slightly behind and be comfortably apart from the front foot. This achieves a stable base and allows for an even distribution of weight. Now that you are properly positioned, bend your knees. Bending your knees enables you to get down to the load and to use your legs to lift. This way, instead of straining the back, the thigh and leg muscles are used, and these are the strongest part of the body. Now you can obtain a proper hold on the object. Ideally, with the proper hold, the arm should be straight, with the hands diagonally opposite for security and comfort. Try to use the full length of your fingers, and where possible, the palms of the hands to avoid fatigue. Make sure the back is kept as straight as possible and as close to upright as possible, with your head level. This will help keep the spine straight and enable you to see where you are going. Now you are fully in position and ready to lift. With your back as upright as possible, your head level, and your arms straight, tighten your abdominal muscles and begin to lift with your legs. Avoid jerking and use smooth, even motions. Do not twist your body as you lift. If you need to change direction, wait until you are fully upright and turn using your feet. When carrying a load, remember to keep your movements smooth and to avoid any fast or jerky motion. Do not change your grip while carrying and do not twist your body. Keep the load close to your waist, and all loads should be carried between your waist and your shoulders, as this will allow you the most stability and control. When setting down a load, the reverse procedure to lifting should be applied, using your legs, not your back, to handle the load. Do not twist as you are putting down the load. If the load requires adjustment, lower it first, then push or pull it into place. Regardless of the shape and appearance of the object, the principles of safe lifting remain the same. So in summary, the basic steps for safe lifting are: clear and assess the area. Check and size up the load. Take proper foot position. Bend your knees. Keep your back upright. Take a proper hold. Lift with your legs and keep the load close to your waist.